Hey everyone, my name is Tilashini, DEM06222096. Today I am going to talk about rational emotive behavioral therapy. What does it mean and who found it? REBT was first developed by psychologist Albert Ellis in the 1950s as an alternative to psychotherapy. Today the term psychotherapy encompasses numerous different types of talk therapy including REBT. At the time that Alice started developing REBT, however, psychiatry mainly consisted of patients just talking with a therapist about what was bothering them, with no real focus on shifting thought process or behavioral patterns. When creating REBT, Alice adopted a different, more psychopathical tag. The foundation of REBT is the premise that some thought processes are illogical, especially imperative thoughts. Tell us we must or should do something. These irrational beliefs can easily develop into harmful action or even secondary illogical notions when we fail to live up to expectations. Thank you. That's all from me.
Hi Miss, nama saya Sharmila S. Krishnan, DEM06222171. REBT is an action-oriented approach that focuses on helping people deal with irrational beliefs and learn how to manage their emotions, thoughts and behaviors in healthier, more realistic way. According to REBT, in our cognition, emotions and behavior are connected. In order to understand the impact of events and situations that people encounter throughout in their life, it's essential to look at the beliefs people hold about this experience and the emotions that arise as a result of those beliefs. The main goal of REBT is to help people respond rationally to situations that will cause stress, depression or other negative feelings. When faced with this type of situation in the future, the emotionally healthy response will be to realize that it's not realistic to expect success in every endeavor. All you can do is learn from the situation and move on.
Hi, my name is Aditya son of Aldas from batch 27A DM06222306. Today I will explain about technique or concept from rational emotive behavior therapy. Today I will explain 2 points concept of REBT. First point is irrational belief. Irrational belief is a REBT identifies specific irrational beliefs such as demandingness, awfulising, and low frustration tolerance. This challenging is central to the therapy. Second point is disputing irrational beliefs. Disputing irrational belief is a therapist encourage clients to dispute and replacing irrational beliefs with rational ones through logical reasoning, evidence-based of arguments, and the examination of consequences. The next one is technique of REBT. The first point of technique of REBT is a behavioral homework assignment. Behavioral homework assignment is clients are often given tasks to practice new rational behaviors and thought patterns in real life situations, reinforcing positive changes. Second point of technique REBT is a role play. Role play is kind of used to simulate real life scenarios, allowing individuals to practice responding to situations in a more rational and constructive manner. And that's all for now. Thank you.
290. Today I'm going to talk about 2 concepts and 2 techniques of rational emotive behavior therapy. The first concept of rational emotive behavior therapy is disputing irrational beliefs. That means therapists encourage clients to dispute and replace irrational beliefs with rational ones through logical reasoning, evidence-based arguments, and the examination of consequences. And the second concept is unconditional self-acceptance. That means encourage individuals to accept themselves to despite mistakes or shortcomings, fostering a more positive self-image. And the first technique of rational emotive behavioral therapy is cognitive restructuring. That means involves identifying and challenging irrational thoughts, replacing them with more rational and realistic beliefs to help individuals reframe their perspective on situation. And lastly, the second technique of rational emotive behavioral therapy is mindfulness and acceptance techniques. That means incorporates mindfulness practice to help individuals to observe their thoughts without judgment and accept their emotion, fostering emotional resilience. Thank you.
Hi Miss, my name is Kumaran, son of his another. ID number is DEM2553. The personal issue of me that I can relate to the REBT is whenever I do something, I think it will be ended up in a problem or it won't be correct. But later I have changed my thoughts about myself. However, nowadays I can do anything with full confidence because I have no more self-doubt like this at all. Thank you.
Saya Agila Chandran dari batch 27B. REBT helped me to solve my personal issues in my life. For an example, if Miss asks me any question, I cannot give the right answer. If I give also, my classmates and my lecturers don't like my ideas. It means I'm worthless. I'm letting myself down and I cannot handle the pressure. It's unbearable. REBT involves distributing catastrophic thinking helps you realize that while stress is challenging, coping strategies can be developed. Thank you.
Hi Miss, my name is Jagdishwaran. My ID number is DM062209 and I'm from batch 27B. I'm going to present about the addiction. Addiction is defined as not having control over doing, taking or using something to the point where it could be harmful. Also, addiction makes us to lose our control over the actions. Example, we will always love to smoke means we cannot control without smoking one day. At the same time, our mind will start to control us, like go to some private places to make some privacy and start smoking. Of this addiction, we can lose the friendship, relationship, hurting family and losing a job. This is why everyone tells addiction is a type of hell in our life. Like when we addict to something, to smoke, drink, alcohol, drugs, it's very difficult to control ourselves when addict to something. Even I also addicted in playing games at my 16 years old. Every time I'm playing games when I came from school, evening at night time, I played games until 1 a.m. because I love to play games. Also that was my favorite and name of game is PUBG. Always my mom and dad scolds me because of my routine after I came from school. When I SPM became near, I tried to stop playing games, but it was difficult to me to stop. Sometimes I do revision my trial also. My mind tells me play a game PUBG, but cannot control myself many times. Sometimes I control. But when my SPM exam near ready, I totally avoid playing games and also I start to focus on my SPM. From that until now, didn't addicted to something because I know it's too difficult when we addicted to something.
Hi, my name is Kawikatin Analikit Kalikumar, batch 27A, ID number DEM04222177. Today I want to take a video assignment about my presentation. We're taking is the main topic is a retinal emotive behavior therapy RBT. How this work? According to the RBT, our continuing emotional and behavior are connected. In the order to understand the impact of the event and situation, life is efficient to look at the belief people hold about this experience and the emotion that arise as a result for those beliefs. From my own opinion, I also get personal issues matter and get down in my life, but I get overcome in my life by my doing a motivate issues like I hang out with my friends and get lost my all depression stress with them. After that, if I am alone, I will play games that I make a happy, feel good, better. Anything and more. I also spend time with my family that make me happy. I every day had a dinner with them and make a good. I just make my life busy that I'm not get a depression or feel like alone or I get stressed. So I will always do activity like playing football or doing playing hobby or playing computer games. I also get when I free I will also go doing my helping my friends or get a part-time job and do myself. So that's the tips I can show you guys how to overcome the RBT. All issues can solve in the own way we got. Don't get down. Thank you for me.